This is the news in brief from the United Nations. UN Chief Antonio Guterres called on Wednesday for an immediate humanitarian ceasefire in the Middle East to ease the epic human suffering in the Israel-Gaza conflict. Speaking in Beijing, Mr. Guterres said that a ceasefire would provide sufficient time and space to realize two essential appeals which he had made earlier this week to Hamas for the immediate and unconditional release of the hostages held in Gaza, and to Israel to immediately allow aid to enter the sealed-off enclave in the throes of a devastating humanitarian crisis. The region is on the precipice, he warned. The call came a day after hundreds were killed in a strike on El Ali Hospital in Gaza City, which Mr. Guterres strongly condemned, stressing that hospitals and all medical personnel are protected under international law. Both sides have blamed each other for the carnage. Trucks carrying life-saving aid remained lined up at the Rafah crossing between Gaza and Egypt. Relentless diplomatic efforts by senior UN officials to obtain humanitarian access were set to continue, with Relief Chief Martin Griffiths on the ground in Cairo, where he will be joined by the Secretary General on Thursday. In Afghanistan, urgent funding is needed to feed some 100,000 people left hungry and homeless by a series of deadly earthquakes, amid a broader and already underfunded humanitarian crisis. That's the message from the UN World Food Programme, WFP, who appealed on Wednesday for $19 million to provide emergency food assistance to those in desperate need in the country's western Herat province. The agency's deputy director in Afghanistan, Anna Maria Salwana, stressed that to assist earthquake survivors, WFP is having to take this food from an already severely underfunded program in Afghanistan. Disasters like these earthquakes pound communities who are already barely able to feed themselves back into utter destitution, she said. Earlier this year in Afghanistan, WFP was forced to cut off assistance for 10 million people due to a massive funding shortfall and can currently only support 1 out of 5 people who need food assistance to survive. In addition to the earthquake response, WFP said that it urgently needs $400 million to pre-position food before the fast-approaching winter months, when communities are cut off due to snow and landslides. In war-torn Sudan, food insecurity and disruptions to essential services could cost the lives of more than 10,000 children under 5 by the end of the year, the World Health Organization (WHO) and the UN Children's Fund (UNICEF) said on Wednesday. The agencies also warned that millions of children in the country are at risk of cholera, dengue, measles, malaria, and other diseases without sufficient containment capacities. After more than 6 months of conflict, Sudan's health system is on its knees. WHO and UNICEF said that health workers have gone without pay for months, and more than 2 out of 3 hospitals in conflict-affected states are not functional. Some 700,000 children in the country are suffering from severe acute malnutrition, and 100,000 require life-saving treatment for acute malnutrition with medical complications. WHO and UNICEF said that they have been working with partners to ensure primary health care, life-saving medical supplies, and nourishment are accessible to the most vulnerable, while also supporting the health authorities' response to a deadly cholera outbreak which started last month. However, they warned that current resources can only help reach a fraction of those in need. And to Guinea, where a diphtheria outbreak has killed 58 people, among hundreds of reported cases, many of them babies and toddlers. UN Health Agency WHO said on Wednesday that 538 cases of the disease were reported from the 4th of July to the 13th of October in the east-central Kankan region. More than 80% of them were children from 1 to 4 years of age. According to the UN Health Agency, diphtheria is a highly contagious disease caused by bacteria, which can be lethal in up to 40% of cases when there is poor access to treatment with diphtheria antitoxin. Diphtheria can be prevented through vaccination, but in Guinea, WHO said that immunization coverage against the disease has remained below 50% for the past decade and was reported to be only 47% in 2022. That's a far cry from the 80 to 85% required to maintain community protection, WHO said. The UN Health Agency stressed that none of the 538 people who got sick in the current outbreak had been vaccinated. Dominika, Tomaszewska-Mortimer, UN News.